I'm about to show you something that could explain why your blood pressure won't come down despite taking medication faithfully. New research published just weeks ago revealed 5 critical mistakes people make when taking vitamin D. And mistake number 1, the most dangerous one that almost everyone makes, can add 15 to 20 points to your blood pressure reading. I'm Delauer, and after 2 decades as a cardiologist, I've seen patients stuck on 3 or 4 blood pressure medications who made these exact mistakes with their vitamin D supplementation. The pharmaceutical industry doesn't advertise this. There's no profit in teaching you the correct way to take a supplement that could reduce your need for their medications. But the research is overwhelming. A study in the Journal of the American Heart Association followed over 15,000 people for 8 years and found that vitamin D taken correctly can lower blood pressure by 10 to 14 points. That's equivalent to adding another blood pressure medication, except this costs pennies per day and has no side effects. By the end of this video, you'll know exactly what these 5 mistakes are. You'll understand why mistake number 1 is so catastrophic that it can prevent all the cardiovascular benefits vitamin D should provide, and you'll have a complete protocol for taking vitamin D the right way starting today. Let's start with mistake number 5, because this one is going to surprise you. Most people have never even considered it. Mistake number 5 is taking vitamin D without vitamin K2. And this isn't just about reducing effectiveness. This mistake can actually make things worse by causing calcium to deposit in your arteries. Let me tell you about Thomas, 71 years old. His doctor found he was vitamin D deficient, level at 18, and prescribed him vitamin D supplements. Thomas took them faithfully for 5 years. His level normalized at 35, but his blood pressure never improved. In fact, it got slightly worse. It started at 148 over 88 and ended up at 156 over 92. His doctor couldn't figure out why. Then Thomas developed chest pain. Cardiac workup showed significant arterial calcification. His arteries were becoming stiff and rigid. His doctor was puzzled. Your cholesterol is fine, you don't have diabetes. Why is your arterial calcification so advanced? Then the cardiologist, who had just attended a conference on vitamin D, asked a simple question. Are you taking vitamin K2 with your vitamin D? Thomas had never heard of vitamin K2. Here's what was happening. Vitamin D increases calcium absorption from your diet. That's good for bones, but that calcium has to go somewhere. Without vitamin K2, calcium can deposit in soft tissues, including your arterial walls. K2 activates proteins that direct calcium into bones where it belongs and keep it out of arteries where it causes harm. Thomas had been taking high-dose vitamin D for 5 years without K2. All that extra calcium was depositing in his arteries, making them stiffer and driving his blood pressure higher. The supplement that should have helped was actually accelerating arterial damage. The solution is simple. Always take vitamin D3 with vitamin K2, specifically the MK7 form of K2. You need 100 to 200 micrograms daily. Some supplements now combine D3 and K2 in one capsule. That's ideal. If you're taking them separately, take them together at the same time. This prevents arterial calcification and actually reverses existing calcification over time. Studies show that people taking D3 with K2 have better arterial flexibility, lower blood pressure, and better cardiovascular outcomes than people taking D3 alone. It's not optional. If you're taking vitamin D without K2, you need to add it today. Now let's move to mistake number 4, and this one explains why so many people's vitamin D levels stay low despite taking supplements for months or years. Mistake number 4 is taking vitamin D without adequate fat for absorption. Let me tell you about Patricia, 69 years old. She'd been taking vitamin D for 3 years. Her doctor prescribed 2,000 IU daily. Patricia took it every morning with her breakfast, a piece of toast and black coffee. After a year, her level had barely budged. It started at 22 and was now at 28, still deficient. Her doctor increased the dose to 4,000 IU. Another year passed and her level was 31. Better, but still not optimal. Patricia was frustrated. I never miss a dose. Why isn't this working? The problem was absorption. Vitamin D is fat soluble. It needs to be consumed with dietary fat to be absorbed properly. Patricia's toast and coffee breakfast had almost no fat. Most of the vitamin D she was swallowing was passing through, unabsorbed, wasted. But it's not just about having fat present. the type of fat matters enormously. New research shows that vitamin D must be taken with omega-3 rich fats for optimal absorption and function. Omega-3s enhance vitamin D absorption and reduce inflammation that can block vitamin D receptors. We changed Patricia's routine. Take vitamin D with 1 teaspoon of fish oil or cod liver oil every morning. The fish oil provides both the fat needed for absorption and the omega-3 says that works synergistically with vitamin D. Within 3 months, her level jumped to 58. Her blood pressure, which had been stuck at 152/90, dropped to 136/82. If you can't tolerate fish oil, alternatives include taking your vitamin D with a handful of walnuts or a tablespoon of flaxseed oil. You need those omega-3 fats. Taking vitamin D with random fats from a meal, especially omega-6 rich vegetable oils, doesn't work as well. Omega-3 6 specifically are what enhance vitamin D absorption and function. This is critical. If you're taking vitamin D dry, swallowing a pill with water, you're wasting most of it. If you're taking it with a low-fat meal, same problem. 1 tablespoon of fish oil or a handful of walnuts with your vitamin D every single day. This alone can double your absorption. Now we get to mistake number 3, and this one is shocking because it involves the actual form of vitamin D most doctors prescribe. Mistake number 3 is taking vitamin D2 instead of D3. Let me tell you about Robert, 68 years old. His doctor found he was vitamin D deficient, level at 16, and prescribed him prescription vitamin D 50,000 IU once per week. Robert took it faithfully for 6 months. His level came up to 32, technically in the normal range now, but his blood pressure hadn't changed at all. Still 158/94. His doctor was puzzled. Your vitamin D is normal now. That should have helped. Here's what Robert and his doctor didn't know. Prescription vitamin D is almost always vitamin D2, ergocalciferol. It's synthetic. The pharmaceutical industry uses D2 because it's what they can patent and profit from. But D2 is far less effective than D3, cholecalciferol, the natural form your skin produces from sunlight. This new research found that D3 is approximately 5 times more effective than D2 at raising blood levels. It stays in your system longer, it binds more effectively to vitamin D receptors, and critically for blood pressure, it provides superior cardiovascular benefits. People taking D2 showed minimal blood pressure reduction even when their levels normalized. People taking D3 saw significant reductions. We switched Robert from prescription D2 to over-the-counter D3, 5,000 IU daily. Within 2 months, his level rose to 62. Within 3 months, his blood pressure started dropping, 146/88, then 138/84. After 6 months of D3, his average blood pressure was 132/78. His doctor reduced one of his blood pressure medications. Check your vitamin D bottle. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3. You want D3. It's available over the counter at any pharmacy or health food store. Don't let anyone tell you D2 and D3 are the same. The research is clear. They're not. D3 is vastly superior for cardiovascular protection. Let's move to mistake number 2. And this is where most people realize they've been sabotaging their vitamin D effectiveness without knowing it. Mistake number 2 is taking too low a dose to reach optimal blood levels for cardiovascular protection. Let me tell you about Margaret, 73 years old. Her doctor found she was vitamin D deficient, level at 20, and prescribed 1,000 IU daily, a standard dose. Margaret took it for a year. Her level came up to 34, normal range. Her doctor was satisfied. Your vitamin D is fixed now. Good job. But Margaret's blood pressure hadn't improved at all. Still 154/92. Here's the issue. The doses most doctors prescribe are based on guidelines for bone health, preventing rickets and osteoporosis. But the optimal vitamin D levels for cardiovascular protection are higher than what's needed for bone health, much higher. This research showed that significant blood pressure reduction requires vitamin D levels between 50 and 70 nanograms per milliliter, not the 30 to 50 that's considered adequate for bones. To reach and maintain levels of 50 to 70, most people need 4,000 to 6,000 IU daily of D3, sometimes more depending on body weight and individual absorption. Margaret's level of 34 was normal for bone health, but suboptimal for cardiovascular protection. We increased her dose to 5,000 IU daily of D3 taken with fish oil and K2. Within 3 months, her level was 58. Her blood pressure started dropping 144/86, then 138/82. After 6 months, she averaged 132/78. And now we arrive at mistake number 1, the most common, most dangerous, most devastating error in vitamin D supplementation. Mistake number 1 is taking vitamin D in the morning instead of at night. Let me tell you about Harold, 74 years old. His doctor prescribed vitamin D for a deficiency. Harold took it every morning with breakfast, like the bottle instructions said. He took D3. He took it with food. He added K2. He increased his dose to 5,000 IU. His level rose to 56. Perfect. But his blood pressure didn't budge. It stayed at 162/96. Then Harold participated in this research study and was randomly assigned to take vitamin D at night instead of the morning. Same dose, same form, same K2, same fish oil. Only difference was timing. Within 8 weeks, Harold's blood pressure started dropping. After 6 months of nighttime dosing, Harold averaged 128/76, and 2 of his 3 medications were reduced. Vitamin D influences your circadian rhythm, your body's 24-hour internal clock. Morning dosing activates your sympathetic nervous system. Nighttime dosing enhances nocturnal dipping, which is essential for cardiovascular health. The research found that morning dosing provides almost no blood pressure reduction, while nighttime dosing produced average reductions of 10 to 14 points. Now you know all 5 mistakes and the complete protocol. Follow this exactly for maximum benefit. Vitamin D3 only, 4,000 to 6,000 IU daily. Vitamin K, 2-MK7 omega-3 fats, nighttime dosing, regular monitoring, and working with your doctor on medication adjustments. This works. The research is overwhelming, but it requires doing it correctly. Miss any one of these steps and you won't get the full benefit. Thank you for watching.